government plan to decongest Kenyatta National Hospital, Mama Lucy, Pumwani and Mbagathi hospitals. The hospitals launched by the head of state in the 4-hour night operations were two level 2 hospitals at Gishangi in Kangemi and Gatina in Kangware, as well as level 3 hospitals in Mukuru kwa Ruben, Tasia, Kwandege and Our Lady of Nazareth Mukuru Kwanjenga. Now, Uhuru was accompanied by NMS Director General Mohammed Badi and several senior government officials, directed public hospitals in Nairobi to offer 24-hour services to ensure city residents access health services actually whenever they need them.
Mambo yako na wewe pia unajisikia sawa? Unajitayarisha?
Why did we go at night? We went at night because of 2 reasons. First and foremost, we wanted to ensure that we were observing COVID protocols, and as you have seen for yourselves, it would have been impossible to go and do what we did today during the day because of the number of people who would have been out there. It would have made that very difficult for us to be able to do the job we want to do and at the same time observe the COVID protocols that as a government we have put in play. So that necessitated that this kind of action needed to be done at night. Second was we also discovered that Nairobi hospitals opened at 8 o'clock in the morning and were closed at 6 o'clock in the evening. Meaning that therefore, those few hospitals that were actually available within the city of Nairobi, if somebody got sick or was in need of medical attention, it meant that if it was after 6, the only facility they could access, again, was Kenyatta National Hospital. So we decided that it was important that these hospitals that we are building operate on a 24-hour basis. And as a result, this is what we also wanted to see, whether it was possible, both from an accessibility point of view and a staffing point of view. And one of the things that we have established is that for the 19 hospitals that we are now opened in Nairobi, we have employed 2,000, almost 500 people to man those hospitals. But we need additional staff, which is one of the things that came out of this evening's tour, in order to be able to ensure that those hospitals are operating 24 hours and that day or night residents can get service, and they only need to be referred to Kenyatta or to Mama Lucy when the cases are serious.
That's good news for Nairobians. 5 hospitals commissioned by the president last night, and he stated the reason as to why he had to do that at night. So let's go to our top story, and that is the panel that is selecting the next commissioners for the IEBC, and the race to fill 4 vacant positions at the Independent Electoral and Boundaries Commission kicks off